कहाँ पे टैकल करना है। अब तीसरा मसल जो हम देखेंगे, इसी पोजीशन में आपने अडक्टर्स देखेंगे। इतने बड़े बच्चे के लिए इतना अडक्टर इज नॉर्मल, काफी। बच्चे को उल्टा लिटा के आपने रेक्टस चेक कर लेना है।
उल्टा लेके पेट पे लेट जाएगा। हाँ, और हाथ दोनों पीछे कर, गर्दन एक तरफ कर। वेरी गुड। और आपने
अब ये यहाँ पे है, मैं ये
देखना है,
हिप को देखना है।
मोड़ना नी
यदि ये मैं जब इसको नी जॉइंट को बेंड करता हूँ, इसकी हिप यूं हो जाती है,
उठता है,
उड़ जाती है, तो इसका मतलब रेक्टस भी स्पास्टिक है या कॉन्ट्रैक्टेड है।
रेक्टस फेमोरस टेस्ट पॉजिटिव,
राइट। तो ये एक ही बच्चे में आपने काफी कुछ सीख लिया। डायनामिक कॉन्ट्रैक्चर, स्टैटिक कॉन्ट्रैक्चर, कार्डियोस R1 R2 आपने देख लिया है, आपने पॉप्लिकल एंगल देख लिया है। सो दिस इज व्हाट वर्कशॉप इज ऑल अबाउट। यू नीड टू लुक एट दीज फीचर्स, राइट। आ जाए बेटा, थैंक यू सो मच।
ध्यान से।
Patient's progress. So what does Pirani scoring system contains? So there are 6 clinical features have been identified by Pirani et al. To assess the severity at the birth and to also assess the progression of treatment. So the scoring system allocates 0, 0.5 and 1.0 for each 6 clinical features. So there are 2 things that you have to remember in Pirani scoring system. The first is midfoot contraction score, the other is hindfoot contraction score. So in midfoot contraction score, you have to look for 3 things. First is medial crease, lateral border of the
Case of club foot, I'll hand the mic over to Balkesh.
you remember. Then you can calculate the deformity. Pirani scoring system for like children below 3 or 4 years, but even in this age group also we can do Pirani as well. So in this case, for the median case there is a single deep, so that would be 1. Okay. Then the lateral border of the foot. If you can get a pen or something, or even with you can see here. Okay, so that is again 1. So this is 1, this is 1. Now you have to push the lateral head of talus inside. It's completely fixed. Completely fixed. So this is again 1. So midfoot contraction score here is 3. So even then you have to go posteriorly, like here. Okay. You have to look there posteriorly then. About the posterior crease. Posterior crease. Here there is a. I won't say it is 1. It is like there are 2 creases available. So it's like 0.5. Then with the use of index finger, you have to heat. It's more like tip of nose. It will be 0.5. Then you have to just skip, and it's not moving at all. It is 1. So its hindfoot contraction score is 2, midfoot contraction score is 3, total foot contraction score will be 5. Then another thing where you have to really focus on in this patient, because she is umar kitna bachche?
9 years.
9-year-old, you have to rule out spina bifida. Ulta लिखाना बच्चे को, because spina bifida is associated with clubfoot. Spina bifida, you have to palpate here, palpate here, palpate here.
हल्का सा प्रॉपर रोल होगा तो तकलीफ नहीं है जी, जख्म जैसा कुछ है।
You have to rule out spina bifida and clubfoot. That is for sure. Especially in this 9-year-old, you have to look up perfectly nice. Okay. Then the third thing is you have to look for spasticity as well. There is no spasticity.
This is basically a neglected
Idiopathic. It's an idiopathic. It's a neglected idiopathic clubfoot. There is no deformity available. There is कोई दूसरे joint में कोई तकलीफ नहीं है. There is no other deformity, so the arthrogyposis needs to be excluded as well. Then Marfan syndrome, the flexibility will be really high. Ehlers-Danlos flexibility, so flexibility is normal. So it's just a neglected idiopathic clubfoot in this case. Okay.
Right. Thank you. Deformity and how to evaluate. It has been beautifully shown by Dr. Pradesh. We have amongst us of who is very keenly looking after these children with disability for the last 35 to 40 years. I can say that he is the senior most person in Jalandhar who has contributed a very big part of his life to rehabilitation of these children. So now we begin with the inauguration. Dr. Mrs. Jalandhar oberoi and Dr. Oberoi to come at the dais and take the proceeding. But dear friends, welcome to today's scientific program on the occasion of World Disability Day organized by Oberoi Hospital Jalandhar in collaboration with ICD New Delhi. ICD is Dr. Mansoor Alam's organization in Delhi. Last few days since we started organizing the function, so many people asked me who is the chief guest. Truly speaking, I tried to contact leaders from political parties, bureaucrats, but my request was politely turned down. It dawned upon me that not many people in high places have time to spare for our differently abled children. Another thing that I realized was why political leaders or bureaucrats? These children themselves are our chief guests. We don't have to look around very much amongst us. Our wonderful young differently abled chief guests are from a very humble background. They study in government schools. Their parents work hard to look after them, to send them or physically carry them to the school, to provide 2 times meal and to make the ends meet. Equally amazing are these school teachers and therapists who guide them regarding the treatment, orthosis and physiotherapy. Once rehabilitated, these children go out in the world and contribute to the society and to national unity. Thanks and welcome once again. I now request Dr. Mrs. Jalandhar to conduct the proceedings and Dr. Oberoi Anand to accompany her and conduct the proceedings as well. Please come.
And hearty welcome to you all. You know today is World Disability Day, so we congratulate you all on this occasion, and I especially give a big hand of applause to Dr. Amarjit Anand, who is a big charity, Dr. Mansoor Alam, Delhi, and Dr. Shilpi Jetli. We really acknowledge your presence. We welcome you all on this platform. you know, because we gathered here and all the delegates, we are gathered here on this occasion. So you know, as said by Henry Ford, coming together is the beginning, working together is progress, and keeping together is a success. So together we can achieve each and everything and anything in life. We acknowledge the presence of all dignitaries, speakers, patients, delegates, and all other who are on the dais or off the dais. I welcome you all from the core of my heart. Now we are going to start the inaugural ceremony. I also welcome Dr. Arpana Chota. She has come. She is into the disability services for the last so many years, and we welcome her and we really acknowledge your presence, madam. I request now to start the inauguration. Most of the time the chief guests are so many political persons, but here we invited our young patients, young children, and I request Mr. Gagandev and Satyam and all other differently able young chief guests to come forward, and we are going to start the light lamp of Bataja. Speaker of the day and workshop coordinator Dr. Mansoor Alam. Now I also I request Mr. Amarjit Singh Anand, who is expert member, State Advisory Board, Divyang Jan, Technical Advisor Parivar, member of many important state and central committee, and has many honors and awards towards the contribution to differently able children. Now I invite Dr. Shilpi Jetli, Head of DAV Physiotherapy, please come over and grace the occasion. Now, Dr. Virendra Prasad, who is in charge of pediatric physiotherapy, please come forward, sir. We really acknowledge your presence. Now, Dr. Suresh Mani, who is head of department of LPU physiotherapy, he has come. Okay. Dr. Neeraj Katyal, head of APGP physiotherapy. No. Dr. Arun Shetty. No. Okay. Now I invite Dr. H.S. Oberoi, who is the senior orthopedic surgeon, and into the treatment of disabled children. Dr. Baldeep Singh Oberoi, he also did MS orthopedics from CMC Ludhiana. He is into the pediatric orthopedics are invited. I also invite Dr. Priya Oberoi. Please come forward for the inaugural function.
सब थोड़ा ठीक है सामने से
Please come forward. Please.
Yes, look here. Yes. Hi, please. Yes. Okay.
Let us introduce our chief guest of today's function. Gagandeep. He was 10 years old when he presented with a gross deformity of the leg. The leg was broken a little below the middle of the leg, and it was bent to practically 95 degrees, right? When he came to us, he was 10 years old, and there was a history of fall when he was 4. So for last 6 years, parents have tried a lot, but nothing came out. Was treated by repeated plaster cast, but the fracture refused to unite. Multiple surgical interventions were done, but they all failed. The last attempt was tibia plating, done elsewhere. It led to infection, required plate removal, antibiotic, dressings, but again, the deformity persisted. The deformity progressed over time to the present situation. After an unsuccessful prolonged treatment for over 6 years, parents came to our clinic requesting for an amputation and prosthesis fitting. On examination, this was the leg. He has an angulation, non-linear the fracture side, poor skin condition, and there were spots on the trunk. Extensive scarring from previous surgeries, infection on the anterior aspect of the lower third leg, soft tissue contracture posteriorly. Can you see the contracture posteriorly? The bony deformity is bad, but equally bad is this posterior soft tissue contracture. The TA is tight, flexor halves as long as it's tight, flexor digitorum longus is also tight. But foot was sensate, soft and supple. Foot कैसा था? बहुत बढ़िया. अब एक सर्जन को पूछो आप, यदि इतना बढ़िया फुट है और पेरेंट्स या रिक्वेस्ट कर रहे हैं कि निकाल दो, it is difficult, right? So we ask for a chance. We osteotomize the fibula, remove the piece of tibia, the bone that was bad was removed. This portion, the white portion was bad, it was removed, and medullary canal was opened, and then a rod was put inside. Right? The bone ends were aligned. You see the soft tissue contractures gone, the leg is straight, and the wound was closed, and above knee plaster was applied. Plaster was removed after 8 weeks, and AF was provided. Physiotherapy and weight training of rehabilitative work was started immediately after plaster removal. And this was the pre-operative, and this is the post-operative. These are the orthosis. This is the fractures has started uniting, and our Gagandeep has started walking a little bit. He has started walking a little bit with Rolita. Then the nail which was put inside was removed, and today Gagandeep is walking satisfactory, but he will take some more time to recover fully. So this is his father's testimony, right? And our chief guest today was Gagan. So this was the problem that we had, and this is how we overcame this problem. The second chief guest is Shubham. Sorry. Satyam. Second chief guest is Satyam. Dr. Baldish talked about arthrogryposis. He said that in arthrogryposis the deformity becomes so severe it's impossible to correct, sort of. So this child, Satyam, who lighted the candle in front of you, had arthrogrypotic deformity since birth. And this child is 7 years old, presented with severe fixed flexion deformity noticed by parents since birth. Chief complaints were inability to stand and walk. If the knees bend like this, the child cannot stand and walk. The child had never walked after birth. But can you see something at the knee joint over here? Callosities. Right? Why are these callosities there? Right? Because this child, Satyam, could still walk on his knees. He could still walk on his knees. If he can do that, we decided that this child needs to be straightened out. And if we straighten him out, he may possibly walk. So first surgery was done, soft tissue release including medial hamstring lengthening was done, significant correction of deformity was achieved, fixed flexion of knee deformity improved from 90 degrees to 45 degrees. So after soft tissue, we still have 45 degrees of deformity remaining. Then second surgery was done, second surgery was a bony surgery. Osteotomy was done and full correction of deformity. Can you see? The knee is fully straight now, was achieved. And now this child had started walking. Sorry, this video is not working. But then let us see this in this testimony again. This is his father's testimony. Voice. The best thing is you can child walk right in front of us. He's there. That's okay.
अच्छा जी की नाम बच्चे का सत्यम कुमार कितने पढ़ रहे हैं दुर्गापुर के जिला केड़ा है ठीक है जी तेरा की प्रॉब्लम की सी बच्चे ਨੂੰ अच्छा जी कदों को खड़ा नहीं हो पाता
बचपन से गेट में
अच्छा जी फिर कितना इलाज करवाया जी
बहुत ही हो गया
अच्छा जी
सारे पास हो रहे हैं तेरा नु दूसरी कोई स्कीम आ गई है
अच्छा
ਸਾਨੂੰ ਡਾਕਟਰ ਨੇ ਡਾਕਟਰ ਬਾਤ ਕਰਾ ਕੇ
ठीक है जी
मैंने भेजा दिया तो राय हॉस्पिटल जाकर
ओबराय हॉस्पिटल कितने
अपने जलंधर
ठीक है जी ਤੇ ਉੱਥੇ ਆਪਰੇਸ਼ਨ ਕਰਵਾ ਕੇ ਕਿੱਦਾਂ ਖੁਸ਼ ਹੋਈ
हाँ जी
ਕਿੰਨਾ ਫਰਕ ਆ ਬੱਚੇ ਨੂੰ
बहुत ज़्यादा बात है
ਠੀਕ ਹੈ ਹੁਣ ਤੋੜ ਲੈਂਦਾ
बच्चा शुरू कर दिया शुरू कर दिया 8 साल के
ਅੱਛਾ ਜੀ
पहले किस्मत चमक रहा है फिर बड़ा हो गया अपने आप से ना तो आगे बैठ निकाल लेता है
ਅੱਛਾ ਜੀ
अपने स्कूल चल जाता है
ਵੈਰੀ ਗੁੱਡ
हाँ जी बेटा की बहुत ही चलाਉਂਦੀ ਸੀ ਕਦੇ ਕਿਤੇ ਜਾਣਾ तो थोड़ा पता है कितना ले जाइए
ਬਿਲਕੁਲ
हाँ सही हो गया
ਬਹੁਤ ਵਧੀਆ ਜੀ ਠੀਕ ਹੈ ਸਤਿਅਮ ਚੱਲ ਕੇ ਦਿਖਾਏਗਾ ਪੁੱਤ
प्लास्टर लग गई थी
ਠੀਕ ਹੈ
प्लास्टर लगने के बाद
ਹਾਂਜੀ ਤੂੰ ਬੋਲੋ ਤੁਸੀਂ ਹਾਂਜੀ
हाँ भैया
ਹਾਂ, ਠੀਕ ਹੈ ਜੀ ਤੇ ਡਾਕਟਰ ਸਾਹਿਬ ਦੇ ਕੰਮ ਤੋਂ ਖੁਸ਼ ਹੋ ਜੀ
हाँ जी बहुत बढ़िया डॉक्टर बहुत बढ़िया
ਠੀਕ ਹੈ ਜੀ ਠੀਕ ਹੈ
Right, so this was the introduction to our little chief guests, and we have so many such chief guests with us. We need to concentrate upon them, try to give our best to them, and try to make their life worth living. Amarjit Singh Anand has been doing this for last 35-40 years, and I have been doing this for last 35-40 years. And whatever little contribution we can make to the society, we have tried. We may have succeeded, we may not have succeeded in all the patients, right? But we keep on trying. Right, thank you so much.
Thank you so much. Now I am going to enlighten you about the oberoi hospital. Oberoi hospital was established. Oberoi hospital was established in the year 1988, and for the past 35 years we are serving the differently abled children. For the first 20 years, our rehabilitation program centered around post-polio corrective surgery. Because 20 years back, the polio was very prevalent, but because of the vaccination so proper, it is almost eradicated. Our dedication to rehabilitation of polio-affected children was keenly observed and recognized by then DC Jalandhar Som Prakash ji, who recommended us for Punjab State Award. We were awarded Punjab Sarkar Praman Patra in the year 2000 at the hands of then Chief Minister of Punjab, Shri Prakash Singh Badal ji. As I told you earlier, complete eradication of poliomyelitis came as a big boon to the nation. The disability pattern in children is now changed. Previous the polio affected children were there, but she did MBBS from DNC Ludhiana and post graduation from Amritsar, and now she is working in SGL Hospital Jalandhar. Now over to Dr. Gurpriya Oberoi.
I thank Dr. Jalandhar Oberoi for all the kind words, and without further ado, I request Dr. Mansoor Alam and Mr. Amarjeet Singh Anand to please present a token of love to Gagandeep and Satyam.
Yes. Wait 1 minute.
Very good.
I please. Yes. Okay. Thank you. Okay, sir. Yes. Thank you.
Thank you.
I would like to present a token of appreciation to Dr. Shilpi J.
Yes.
Mansoor Alam and Dr. Baldeep Singh Oberoi to present a token of gratitude to Dr. Virendra Prasad.
Okay. Thank you.
Alam and Dr. Baldeep Singh Oberoi, please present a token of appreciation to Dr. Suresh Mani.
Guests are basically from Nawa Shahar and they were guided by Madam and Ravinder sir.
Mr. Amarjeet Singh Anand and Dr. Harsharan Singh Oberoi to present a token of appreciation to Mr. Raju Chaudhary, SSA Jalandhar. Harsharan Singh Oberoi to present a token of gratitude to Dr. Dheeraj, SSA Hoshiarpur. Singh Oberoi to present a token of appreciation to Dr. Ravinder, SSA Nawa Shahar.
No, he's there. Ravinder sir.
Sir, okay, yes. Thank you.
Baldeep Singh Oberoi to present a token of appreciation to Dr. Manoj. Dr. Baldeep Singh Oberoi to present a token of appreciation to Dr. Imran. Thank you, everyone.
From Jammu.
टीम पूरी आ जाओ आ जाओ
On behalf of KIRF is Kamal International Rehabilitation Foundation, is a government recognized non-government organization. Our main focus is advocating for the rights and entitlement of individuals with disability, and we are working in Jammu and Kashmir since last 10 years. So on behalf of KRF, we are thankful to Oberoi Group of Hospitals for giving us chance to celebrate this World Disability Day here in Jalandhar. As a token of love, we would like to present a memento to Dr. Baldev Singh Oberoi. Dr. Harmeet, Vice President of KIRF, will present this.
Okay, yes.
And we would like to invite him to Jammu and Kashmir for the same function that will be organized by this KIRF group of.
Yes, please, sir. Okay. Thank you.
And behind this today's show, Dr. Harshan Singh Oberoi. The memento will be given by Dr. Harmeet.
Who wants to join us?
Samen. Okay, yes. So one more. Okay, yes. Thank you.
May I request him to come forward and receive a bouquet from Dr. Mrs. Oberoi, Dr. Gurpreet Oberoi, Baldev Oberoi, and I. Gauravjit Singh to join us.
Also, please come here. Wait, one more. Okay.
Seminar. I now request Baldev Singh Oberoi to make his presentation.
सारी चीजें सर ने बताया, लेकिन अपने प्रेजेंटेशन में वायरस ज्यादा खतरनाक, ठीक है। अब अपर लिम्ब में क्या होगा? अपर लिम्ब में ज्यादातर क्वाड्रिप्लेजिक और ट्राइप्लेजिक, हेमिप्लेजिक बच्चों में ज्यादा डिफॉर्मिटी होगा। डायप्लेजिक में अमूमन नहीं होता, क्योंकि डायप्लेजिक में हाथ इन्वॉल्व तो होता है लेकिन इतना नहीं होता। तो ये देखो, ये सारे डिफॉर्मिटी होंगे। नाम सबके नाम जानते हो? ये आखिरी वाले का नाम क्या है? 4 वाले का, ये 5वां लास्ट, क्या नाम है? क्या है इसमें? जल्दी से बताओ, जल्दी जल्दी। देखने में क्या लगता है? चलो थोड़ा घर जाके पढ़ना। थम इन पाम, थम इन पाम डिफॉर्मिटी का नाम है, ठीक है। क्या मैनेजमेंट है? फिजिकल थेरेपी। फिजिकल थेरेपी में क्या करेंगे? पोस्चरल करेक्शन। उसके बाद क्या करेंगे? स्ट्रेचिंग एंड स्ट्रेंथनिंग। फंक्शनल थेरेपी। फंक्शनल थेरेपी का मतलब उनको माइलस्टोन्स में डायनेमिसिटी लाएंगे। क्या देंगे? ऑर्थोटिक एड्स। और क्या करेंगे? इलेक्ट्रोथेरेपी। और उसके आगे ये तो हम खुद ही करेंगे, एज अ थेरेपिस्ट करेंगे। जब उससे आगे बढ़ेंगे तो क्या करेंगे? कीमोडेनर्वेशन। कीमोडेनर्वेशन किसको कहते हैं? बोटॉक्स इंजेक्शन लगाने के टेक्निक को कहते हैं कीमोडेनर्वेशन, ठीक है। और अगर हमसे नहीं रुका तो कहां चले जाएंगे? ऑर्थोपेडिक सर्जन के पास। पोजिशनिंग में क्या करेंगे? पोजिशनिंग का मतलब होता है एक बच्चे को माइलस्टोन ओरिएंटेड एप्रोप्रिएट पोजिशनिंग। जैसे हेड कंट्रोल नहीं आया तो उसको खड़ा मत कर देना, अगर खड़ा करना तो उसको फिजियोलॉजिकल करना, फंक्शनल मत कर देना, क्योंकि उससे आप फायदा कुछ नहीं करोगे, नुकसान कर दोगे। हैंडलिंग एंड कैरिंग ट्रांसपोर्ट टेक्निक, ये सारी वर्कशॉप में सिखाया जाएगा। अभी आप लोगों को सिर्फ नॉमेनक्लेचर सिखाया जा रहा है, ठीक है। पोजिशनिंग के मोटा मोटा 2 टेक्निक बहुत कामयाब है दुनिया में। एक को कहते हैं न्यूरो एनहांसिंग पोजिशनिंग, एक को कहते हैं टोन रिड्यूसिंग पोजिशनिंग। साइड लाइन बोर्ड होते हैं, प्रोन वेज होते हैं, कस्टमाइज चेयर होते हैं, अलाइनर होते हैं, स्ट्रेचिंग फ्रेम होते हैं। ये कैरिंग टेक्निक है। ये देखो कैरिंग टेक्निक जो है, कैसे बच्चे को देखो ध्यान से आप लोग, ये दोनों को ध्यान से देखो। ये जो पहला वाला पिक्चर है, ये आपको कम से कम ये दोनों टेक्निक सिखा दोगे, 80% चांस है तो उसका हिप सबलेक्शन नहीं हो। पोजिशनल डिवाइसेस हैं जो प्रैक्टिस में आप लोगों को जरूरत पड़ेगी। ये सारी पोजिशनिंग है, ठीक है। उसके बाद पोस्चरल एड्स क्या बनाओगे? ये साइड लाइन बोर्ड जो मैंने पहले बताया, बड़ी सारे बनते हैं, अब तो सैकड़ों आ गए मार्केट में। पोस्चरल एड के बाद स्ट्रेचिंग स्ट्रेंथनिंग। स्ट्रेंथनिंग करने के लिए बड़ी टेक्निक है। स्ट्रेचिंग को हमेशा ध्यान से करना, और समय हमेशा मसल्स का फंक्शन को समझना, पोस्चरल मसल को बचा के चलना, क्योंकि लोग कहते हैं, मजाक से कहते हैं होम्योपैथिक दवाइयों का साइड इफेक्ट नहीं होता, इसी तरह लोग कहते हैं फिजियोथेरेपी का साइड इफेक्ट नहीं होता। गलत, दोनों के बड़ी सारी साइड इफेक्ट होते हैं, इतने साइड इफेक्ट होते हैं कि सर्जन भी उसको नहीं सुधार पाते। तो हम क्या करेंगे, इसमें रेंज ऑफ मोशन एक्सरसाइज देंगे, इसके सस्टेन स्ट्रेचिंग पे हमेशा जोर देना, बजाय कि ये छोटे छोटे स्ट्रेच देने का। फास्ट स्ट्रेचिंग मत करना, लेकिन सेलेक्टिव केस में कर सकते हो, वो हाइपोटोनिक अगर मसल्स हैं, ज्वाइंट कंप्रेशन पे जाना, ये सारी चीजें जरूर सीखना। अभी तो मैं खाली आपको ये सिखा रहा हूँ कि कैसे आप बेहतर कर सकते। स्ट्रेंथनिंग प्रोग्राम, इसके मसल स्ट्रेंथनिंग की बड़ी सारी टेक्निक है, इसमें मैनुअल है, इसमें डिवाइसेस है, इसमें थेराबैंड है, बहुत जोड़ सकते हैं, इसमें वेट है। फंक्शनल थेरेपी का मतलब आपको मैंने पहले बताया कि एक बच्चे को पोजीशन में फंक्शनल जो है ना एक्टिविटी प्रैक्टिस करवाना, दैट इज फंक्शनल थेरेपी। ऑर्थोटिक एड्स, इसमें अभी मैं आखिर में बहुत एक लंबी लेक्चर है आप लोगों के साथ। इलेक्ट्रोथेरेपी लगभग सभी फिजियोथेरेपी को पढ़ाए जाते हैं। इलेक्ट्रोथेरेपी में ये ध्यान रखना कि ये सारे मॉड्यूल काम करते हैं। टेंस का इस्तेमाल, सेरेब्रल
Such a senior person who has spent his entire life in the service of disabled children, and Oberoi Hospital feels proud to honor Mr. Amarjeet Singh Anand. Such a wonderful deliberation by Mr. Dr. Mansoor Alam. We now come to surgery in spastic diplegia and spastic diplegia.
Loss infection is 1 for 3 weeks. So, CAS usually change after 1 week.